What's up, guys? How's it going? Cade Moore with More Muscle, and today we're going to be talking about infective bacterial endocarditis. Guys, so remember, this is more of a learning opportunity. Make sure you get proper medical help if you do have this, but this is more of learning. But anyways, let's get to it. This is a life-threatening inflammation of the inner lining of the heart. This lining is called the endocardium. And this is usually caused by an infection. Bacteria, fungi, or other germs can get in the endocardium, and this can cause damage to the heart, and this can cause blood and germs in the bloodstream. So guys, this happens a lot when people are using dirty needles, when they just had a heart surgery and there wasn't proper sanitation used, and somehow some of the germs got on some of the tools and they're now in your heart. Or if you've had a prolonged catheter line or PICC line or something like that, you can get endocarditis. So guys, yeah, this is an infection. Causative organisms include Streptococcus viridans and Candida albicans. Okay, yeah, it's hard to pronounce, but those are some of the organisms that can happen that can get in the heart. So some risk factors include congenital heart disease, indwelling catheters older than 60, artificial heart valves, implanted heart devices, illegal IV use or dirty needle use, poor dental health, long-term catheter use. So basically anything that can introduce those germs into the endocardium, that is how, you can get endocarditis from that. So, using a dirty needle and other, surgeries and stuff like that, those can all cause that. And some signs and symptoms include fever, malaise, murmur, myalgias, diaphoresis, weight loss, splinter hemorrhages, feeding problems, respiratory distress, tachycardia, which is fast heartbeat, heart failure, and septicemia. So some lab tests would be a CBC, complete blood count, ESR, which is a erythrocyte sedimentation rate, urine test, blood cultures, positive or negative. And they can diagnose with an ECG or an echocardiogram or a chest X-ray. Nursing care includes antibiotics for about 2 to 8 weeks. Depending on what your provider prescribes or your doctor prescribes for you. Peripheral central catheter PICC line near the heart is usually what we'll do. And you want to use high level of oral care, so you got to keep your mouth clean. And you want to advise any dentists that you're at high risk for infections. Some education, prophylactic antibiotics for dental and surgical procedures. So guys, that's prophylactic means preventing disease, and you want that for any dental or surgical procedures, and you want to make sure you follow up with a medical professional, and you want to follow antibiotic protocol, observe for fever. And some complications include heart failure, myocardial infarction, which is a heart attack, embolism, stroke, blood clot, kidney damage, enlarged spleen. And you want to report any signs and symptoms, especially a fever that won't go away or unexplained tiredness or fatigue. So that's one of the biggest things, guys, is you want to report any signs and symptoms, especially a fever that won't go away. And you want to also report any unexplained fatigue, because that's usually something your body's saying something's not right. You want to take care of your dental health. You don't want to use illegal drugs, and especially you don't want to use dirty needles. Treatment includes antibiotic surgery, and you might have to spend a week in the hospital, or even more, it depends. So guys, to wrap it up, endocarditis, guys, this is a bacterial infection in the endocardium near the heart, and basically germs, and other harmful substances can get in your heart, and this can come from a dirty IV, surgery where they didn't use clean supplies, or some type of thing like that. Anyways, guys, thanks for watching. Subscribe. Remember, this is more of a learning thing. Make sure you talk to your doctor, professional doctor, before acting on any of the advice I've given. Anyways, thanks for watching. Subscribe.